Is your yoga practice a pain in the butt lately? Have you noticed a painful pull or jab in the back of your pelvis with certain poses and not quite sure what you've done to trigger it or when even? You may be dealing with an all too common injury that shows up on the mat sooner or later for many yogis, myself included, called SIJ dysfunction. I unpack the why and the how this injury comes about in a previous video which I've linked in the description below. I strongly encourage you check this out before or after to better understand some of the terms I use here. Today I'm diving into specifically the 5 poses to watch out for when you're working with SIJ dysfunction and exactly how to modify each. Hi, I'm Kathy from Tribalance Yoga, and I help women who practice yoga who are struggling with hip pain on the mat to navigate their practice without having to stop practicing altogether, and ultimately to transform their movement potential. Before we dive in, I want to quickly recap on 2 terms I described in my previous video: form closure and force closure. Form closure describes the passive restraint or stability in the joint that is provided by the ligaments and connective tissues. Force closure, on the other hand, means activating the stabilising muscles surrounding the sacro-iliac joint that creates like a hugging force onto the joint, keeping it more closed or stable. It is an active restraint. It's important to note here that these 5 poses aren't wrong or bad. They just have a higher likelihood of causing excess strain in the SIJ when there's a deficit in form closure or loose ligaments. By applying adequate force closure, muscle activation, we can mitigate some or all of this deficit in stability created by loose ligaments or by misaligned joint surfaces. The first pose is revolved wide-angled forward bend, Parivrtta, Prasarita, Padottanasana. The pelvis here is a continuation of the spine. So as the spine rotates up, the top hip can lift slightly. So you're not rigidly squaring the hips and the pelvis down towards the floor and then rotating up. To create more force closure, press the feet down and wide as if you're trying to tear the mat in half, and feel your outer hips engaged, your glutes. Simultaneously, draw the inner arches in towards the midline, lifting up all the way through the inner seam of the leg to the pelvic floor. And the second pose is revolved triangle pose, or Parivrtta Trikonasana. And in this position, the back hip is rotated externally slightly, while the front hip is more neutral or internally rotating. And this creates opposite actions in the SI joint on the left to the right, leading to some degree of incongruence in these 2 joints. To increase that congruence and alignment in the pelvis, you can take the back foot a little wider and perhaps a little closer to the front foot. And you'll notice straight away that the pelvis squares more easily. To increase the force closure here, imagine your inner thighs pulling in like magnets, zippering up and in. Feel your right thigh bone hugging up and in towards the hip socket as the left hip rolls more towards the front. Feel your outer hips like a clamp squeezing in towards the midline, feeling that stability that you're creating through the pelvis. The next pose is Warrior 1 or Virabhadrasana 1. And you'll notice here the front hip is in a flexed position, neutral rotation. The back hip is extended and slightly externally rotated, which is creating an opposite action at the right and left SI joints and leading to more incongruence. To increase that congruence in the pelvis, we'll do a pose called Warrior 1.5. So rather than trying to crank the hips around to the very front and square them over that front leg, go as far as you feel you can go before you meet resistance. So that could be 45 degrees, it could be 70, 80 degrees, wherever you land. Then take the arms up and create that last few degrees of movement from your thoracic spine. So you're rotating through your upper back until your shoulders are squared to the front, rather than your hips and pelvis squaring to the front. To create more force closure here, once again, feel the inner thighs pulling in like magnets to the midline, the outer hips clamping in, and feel that stability as you pull back through your right thigh bone. In Hanumanasana, or full monkey pose, the back hip is extended and externally rotating, which is opposite to the front hip, which is neutral and flexed. So the opposite action is creating a shearing force in the pelvis, the sacro-iliac joints. So to modify and create more force closure, take 2 blocks, one on either side of the pelvis, and lift the pelvis away from the floor. Start to roll the left hip forward and pull back through that right thigh bone until you feel the pelvis is more level, more square. To create the forced closure by pulling in through your inner thighs like magnets, clamping the outer hips in towards the midline. And finally is Anjaneyasana, low lunge pose. Similar to Hanumanasana, full monkey pose, the back hip is extended and the front hip is flexed, creating that opposite action and shearing force in the pelvis. So to modify and create more force closure, lift the pelvis away from the floor slightly. Feel the inner thighs pulling in towards the midline, the right heel pulling back towards the left knee. And then imagine you've got a clamp on the outside of your pelvis pulling in towards the midline, hugging the midline. Feel all of that stability and support in your pelvis as you then approach the lunge, moving deeper with support. If you struggle with buttock pain or pelvic pain on the mat, a lack of force closure could be part of the problem. I go into the mechanics of this in more detail in my previous video and blog, which I've linked below. I strongly encourage you to check this out to get a deeper understanding of the underlying mechanics so that you feel more empowered to navigate your practice. If keeping your yoga practice alive and thriving is important to you, grab my free Yoga for Happy Hips pose modification guidebook that I've linked in the description below. I'm here to support your highest movement potential. Namaste.